How can I get a medical license in Japan? Hi, this is Dr. K from Med Insider Japan. I'm a native Japanese, graduated from European med school. I'm sharing information for foreign doctors who want to work in Japan. Today I'd like to explain the structure of the Japanese board examination. It's also called the National Medical Practitioners Qualifying Examination. The exam takes place once a year at the beginning of February, and approximately 10,000 people take this exam every year. If you pass this exam, you get a medical license in Japan. Here's the structure of the exam. It's a 2-day exam, and you need to answer 400 questions in total. The questions are divided into 6 blocks. Block A, B, C are on the first day, and Block D, E, F are on the second day. Each day usually starts at 9:30 in the morning and ends around 18:30. You can have breaks between blocks, but still it's a very long and tough exam that you should prepare well both mentally and physically. You need to cover a broad range of subjects. They ask 400 questions from 25 subjects. The most important is internal medicine because it accounts for 40% of the exam. Public health, pediatrics, and OBGY are also important. Except for some calculations, the majority of the questions are multiple choice questions. They can be classified into 2 types, Type 1 and Type 2. Type 1 questions are simple, fact-based questions. For example, which of the following is most likely to cause peripheral edema? Or which of the following medications is associated with medication-induced esophagitis? They can ask about the cause of disease, pathomechanism, symptoms, lab findings, treatment, and so on. On the other hand, in Type 2 questions, you need to read clinical case scenarios. They usually start with age, gender, and the chief complaint, which is followed by the condition of the patient in detail. You need to understand the paragraph, establish the diagnosis, and choose the best management for the patient in Japanese. For passing this exam, you need to meet 3 criteria. It's a bit complicated, but I'll try to explain. Number 1. The total score of Block A, C, D, and F has to be over 70%. These blocks are a relative evaluation, so this passing score can change a bit every year, but it's usually around 70%. 2. The total score of Block B and E has to be over 80%. Now these 2 blocks are an absolute evaluation, so you have to score 80% for sure. These blocks are also called Hishu because they choose to ask basic but important topics such as medical communication, medical ethics, and so on. 3. The number of contraindications has to be less than 3. Oftentimes in Type 2 questions, you need to choose clinical management for a patient. If your choice is life-threatening for the patient, your answer will be counted as a contraindication. For example, if you choose to give a beta blocker to an asthma patient, it counts as one contraindication. So, be careful. In this exam, random guessing is very risky. It's a complicated system, but if you meet all 3 criteria, you pass. Every year, approximately 10,000 people take this exam, and around 90% of them pass. But the pass rate is different between those who graduated from Japanese med school and foreign med school. For those who graduated the Japanese one, the rate is between 85 to 99%. But for those who graduated the foreign one, it's approximately 50%. It might sound hard, but considering the difference of curriculum in med schools and also the language barrier, it's understandable. But don't give up. I know international doctors do pass this exam, and they are working in Japan. Also, you don't need to get an excellent score on the exam because in Japan, there are no job interviews where you need to present the score of this exam. If you pass, that's all. In summary, the Japanese board exam is a 2-day exam with 400 questions, mostly multiple choice questions, and you need to meet the 3 criteria to pass. Thanks so much for watching. I'm going to upload more videos. If you thought it was helpful, please like the video and subscribe to the channel. See ya!